Capital Region BOCES, Cardiac Arrest Emergency Response Training, developed with the assistance of the Occupational Health and Safety Management Service. Sudden Cardiac Arrest Law. On July 24, 2025, Governor Kathy Hochul signed DACA's law. This law requires all New York schools to adopt cardiac emergency response plans. It amends several sections of the education law, including Section 917, which mandates that schools have automated external defibrillators, or AEDs, on site. Now, AEDs must be clearly marked, accessible, and maintained according to American Heart Association guidelines or other nationally recognized standards. What is cardiac arrest? Cardiac arrest is a sudden, sometimes temporary, loss of function of the heart. It can happen for many reasons, including heart attack, drowning, trauma, or choking. When the heart is starved of oxygen-rich blood, it will cause cardiac arrest. As a result, the heart may stop beating or develop an abnormal heartbeat, which is not capable of providing proper blood flow. The differences between a heart attack and cardiac arrest. These terms are often used interchangeably, but are not the same. A heart attack is caused by a blockage in a coronary artery. Symptoms may include chest pain or pressure, shortness of breath, pain in the left arm or back, sweating, pale skin, and nausea. A heart attack can lead to cardiac arrest. When experiencing cardiac arrest, an individual will have an immediate loss of consciousness. Irregular gasps of air may happen right after collapse. Seizure-like activity can occur. They will not be breathing, not moving, and will have no pulse. Skin may turn pale or blue. Act fast. Begin CPR and use an AED immediately. Recognizing a heart attack. A blocked coronary artery will cause the heart muscle to become damaged and possibly die. This damage can cause the heart to beat improperly or even stop, resulting in cardiac arrest. A person experiencing these symptoms should be kept calm and comfortable. Call 911 immediately and watch closely for signs of cardiac arrest. Recognizing cardiac arrest. A person may suddenly collapse and fail to respond to voice or touch. Seizure-like movements can occur. Watch for agonal breathing, irregular gasps that are not normal breathing. No visible chest rise or movement may indicate they are not breathing. Act immediately. Call 911, start CPR, and get an AED. What is CPR? Cardiopulmonary resuscitation, or CPR, is a life-saving technique. It involves pushing hard and fast on the chest of an individual whose heart has stopped beating properly or has stopped altogether. CPR also involves giving breaths or artificial ventilations, either through mouth to mouth or by utilizing a barrier device to provide oxygen. Pushing the chest up and down helps the heart pump blood through the rest of the body. This keeps blood flowing to the vital organs. CPR essentially buys time until an AED or automated external defibrillator can be used on the victim. Immediate CPR is important. For every minute a person in cardiac arrest goes without it, their chance of survival drops by about 10%. After 10 minutes without blood circulating through the body, the chance of survival is almost zero. However, immediate CPR combined with an AED can double or even triple a person's chance of survival. Know where AEDs are located. The chance of surviving a sudden cardiac event increases dramatically when an AED is properly used with CPR. As a staff member, please be aware of where AEDs are located in your workplace and consider taking a CPR AED course. Capital Region BOCES Cardiac Arrest Emergency Response Training. If you have any questions, please contact your immediate supervisor or HR team at naric.org.